Do you know what an appendectomy is and why it's performed? This common surgical procedure involves the removal of the appendix, a small pouch where the large and small intestines meet. Nestled away in our digestive system, the appendix might seem insignificant, but when inflamed, it becomes a health concern that can't be ignored. So what's the role of this tiny, finger-shaped organ? Well, while scientists are still exploring its exact function, the appendix is believed to play a part in our immune system, particularly during our early years. Despite its potential role, we can live perfectly well without it, which is good news if one ever needs an appendectomy. Now, let's talk about why someone might need this procedure. The main culprit is appendicitis, a condition where the appendix becomes inflamed and filled with pus. This inflammation can occur due to various reasons, including blockage by feces, a foreign body, or in rare cases, a tumor. Appendicitis is a medical emergency that demands immediate attention. If left untreated, the inflamed appendix can burst, leading to a serious infection called peritonitis. Symptoms of appendicitis typically start with pain in the middle of the abdomen that may move to the lower right side, the site of the appendix. This pain is often accompanied by nausea, vomiting, and fever. These symptoms can appear quickly and worsen over a period of 12 to 24 hours. However, not everyone's experience with appendicitis is the same. The pain location may vary, and in some cases, other symptoms like loss of appetite, constipation, or diarrhea may occur. Given the potential severity of appendicitis, it's crucial to seek medical attention if you suspect you or someone else might have it. A swift diagnosis can lead to timely treatment, preventing complications and ensuring a better prognosis. In summary, while the appendix may seem like a small, unimportant organ, when inflamed, it becomes a potential health risk that requires immediate attention. Appendicitis, the inflammation of the appendix, is a medical emergency that requires immediate attention. Appendicitis presents a variety of symptoms that should not be ignored. This medical condition is characterized by an inflammation of the appendix, a small pouch attached to the large intestine. Despite its seemingly insignificant size, an inflamed appendix can pose a serious health risk if not addressed promptly. So what are the telltale signs of appendicitis? Well, the most common symptom is abdominal pain. It often starts near the belly button and then moves lower and to the right. This pain tends to intensify over a period of 12 to 24 hours and can become severe. In addition to abdominal pain, other symptoms can include nausea or vomiting soon after the abdominal pain begins. A loss of appetite, a low-grade fever that may worsen as the illness progresses, and abdominal swelling are also common. Sometimes, it might be difficult to pass gas, and there may be diarrhea or constipation. Now, not everyone with appendicitis shows all these signs, and the intensity of symptoms can vary. It's also important to note that other conditions like gastrointestinal disorders can mimic these symptoms. That's why it's crucial to seek medical attention if you experience any of these signs, especially the abdominal pain. Once you're at the hospital, doctors will conduct a physical examination and may use tests like blood work, a urine test, or imaging tests to confirm the diagnosis. Remember, appendicitis is a medical emergency that typically requires prompt surgery to remove the appendix. If left untreated, an inflamed appendix can rupture and cause a potentially life-threatening infection. So, if you or someone you know is experiencing symptoms that might be appendicitis, don't delay. Seek immediate medical attention. It's always better to err on the side of caution when it comes to your health. Prompt diagnosis and treatment are crucial to prevent complications such as rupture and infection. As the old saying goes, a stitch in time saves 9. In the case of appendicitis, a timely diagnosis could potentially save a life. When the appendix becomes inflamed, an appendectomy is often necessary. This is the surgical removal of the appendix, a procedure that has been refined over the years and is now most commonly performed using minimally invasive techniques such as laparoscopy. Laparoscopy, as the name suggests, involves the use of a laparoscope, a long, thin tube with a high-intensity light and a high-resolution camera at the front. The instrument is inserted through a small incision in the abdominal wall, allowing the surgeon to view the internal organs on a video monitor. The surgeon then proceeds to make 1 to 3 more small incisions, through which specialized instruments are inserted. These tools are used to remove the appendix while causing minimal damage to the surrounding tissues. Once the appendix is detached, it's bagged and removed through one of the incisions. To ensure no infection is left behind, the abdominal cavity is often flushed with a sterile solution. The incisions are then closed using sutures or surgical staples, and finally, a sterile dressing is applied. This laparoscopic approach has several advantages over traditional open surgery. For starters, the smaller incisions mean less post-operative pain for the patient. It also reduces the risk of complications such as wound infections and hernias. Moreover, recovery times are typically shorter with laparoscopic surgery. While an open appendectomy might require a hospital stay of 3 to 5 days and several weeks of recovery, a laparoscopic appendectomy often allows the patient to leave the hospital within 24 hours and return to normal activities within a few days to a week. But remember, every patient is unique, and so is every surgery. The approach your surgeon chooses will depend on several factors, including the severity of your appendicitis and your overall health. The ultimate goal, however, remains the same: to safely and effectively remove the inflamed appendix and pave the way for a swift and uneventful recovery. Laparoscopic surgery offers smaller incisions, less post-operative pain, and faster recovery compared to traditional open surgery. Recovery after an appendectomy varies from person to person. The journey to complete recovery is usually straightforward, but it's important to remember that each individual's body responds differently to surgery. After the appendectomy, most patients spend 1 to 2 nights in the hospital. This allows medical professionals to monitor their recovery closely, managing pain and ensuring there are no complications. A shorter hospital stay is one of the many benefits of minimally invasive surgeries like laparoscopic appendectomies. Once discharged, patients typically need a few weeks to return to their normal activities. The first week might include some discomfort and fatigue. During this time, it's important to rest, stay hydrated, and eat a balanced diet to support healing. In the second week, patients often feel considerably better. They may start to reintroduce light physical activities into their routine. However, strenuous exercise, heavy lifting, and intense tasks should still be avoided. By the third or fourth week, most people are able to return to work or school, depending on the nature of their daily activities. Throughout the recovery process, following the surgeon's post-operative instructions is essential. These guidelines usually include advice on wound care, pain management, and activity levels. It's important to keep in mind that these recommendations are designed to aid recovery and minimize the risk of complications. But what if something doesn't feel right? It's essential to seek immediate medical attention if any unusual symptoms occur. These might include severe abdominal pain, high fever, persistent vomiting, or signs of wound infection like redness, swelling, or discharge. Remember, the goal is a safe and smooth recovery. Being attentive to your body's signals and following the recommended post-operative care are key to achieving this goal. Patients are advised to follow their surgeon's post-operative instructions carefully and to seek medical attention if they experience any unusual symptoms. Appendectomy is a common and generally safe procedure, but it's important to stay informed. We've come a long way in understanding the role and removal of the appendix, but as with all health matters, awareness is crucial. The more you know, the better equipped you are to make informed decisions about your health. Appendicitis is a medical emergency that requires prompt attention. The symptoms can be quite severe, and they usually appear suddenly. Abdominal pain, especially on the right side, should not be ignored. Nausea, vomiting, and fever are also common symptoms. If you experience these, it's imperative to seek medical help immediately. This is not a situation where a wait-and-see approach is advisable. Time is of the essence. The procedure itself, appendectomy, has been refined over the years. Today, it's typically performed using minimally invasive techniques, such as laparoscopy. This approach results in smaller incisions, less post-operative pain, and a quicker recovery. But remember, every individual is different, and recovery times can vary. It's important to listen to your body and follow your doctor's advice during the recovery period. Healthcare isn't just about treating diseases, it's also about preventing them. And prevention starts with knowledge. Understanding what the appendix is, knowing the symptoms of appendicitis, being aware of the surgical procedure, and knowing what to expect during recovery are all part of being an informed patient. Remember, you are your best advocate when it comes to your health. It's important to ask questions, seek out information, and make decisions that are in your best interest. This is particularly true when it comes to matters as serious as appendicitis and appendectomy. So let's make a commitment to staying informed and maintaining good health. Let's seek knowledge, ask questions, and listen to our bodies. Let's take control of our health, because when it comes to health, knowledge is power. Knowledge and awareness are key to maintaining good health. Stay informed, stay healthy.